This week's Ask Dr. Durie comes from a questioner who's aware of a new ASCO abstract presentation in which the combination of KRD was compared with VRD for newly diagnosed multiple myeloma. And so the combination of Kyprolis, Revlimid, and Dex was compared with the combination of Velcade, Revlimid, and Dex. This was a phase 3 randomized trial called the Endurance trial, and encompassed all frontline patients except for those who had high-risk features, so those patients were actually excluded from this trial, and also those patients who were planning to have an upfront transplant. And so this trial did not include all patients, and so this is possibly important in the interpretation of the results. The results of the trial were very, very clear. The primary endpoint for evaluation was how long was the first remission, what we call PFS, the progression-free survival. And the results were that the KRD and VRD had almost identical lengths of remission, right around 31, 32 months. And so there was really no doubt about the impact on this first remission. The other aspects that were important is that the types of toxicities with the two regimens were quite different. As one might expect, the Velcade, Revlimid, and Dex patients had more neuropathy side effects, whereas the patients receiving the Kyprolis had more cardiopulmonary and kidney toxicities. So the outcome was rather clear and thus far also indicated that there was no difference in the overall survival. And the bottom line is that although not all patients were included in this trial, particularly those with high-risk disease, for the majority of patients with myeloma in this newly diagnosed category, it seems that the Velcade, Revlimid, and Dex combination does remain the standard of care for now, and that the switching out of Velcade for Kyprolis did not provide any added benefit. So a disappointing result for many, but it's a helpful result for many as well, because the Velcade, Revlimid, and Dex is widely available and can provide excellent results.